You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Hi, everybody, and welcome to another episode of our Mother to Baby podcast. My name is Chris Stallman. I'm a mom of three and a genetic counselor who is also a teratogen information specialist. For those of you who are just tuning in, teratogen information is information about exposures during pregnancy and breastfeeding. We also provide information on exposures in the pre-pregnancy period as well as adoption. An exposure really can be anything. So it could be taking Tylenol while you're pregnant. It can be getting your hair dyed during breastfeeding. It could be pollution. It could be alcohol. There's a whole wide range of things out there that women just like you have questions about, and we at MotherToBaby are here to answer them. Today is extra special because we're actually recording from San Diego, California, where we're having our annual meeting of MotherToBaby and the Organization of Teratology Information Specialists, or OTIS. And so we have in-house many of the experts that work through MotherToBaby who also have families and specifically are moms. So we're very lucky to have a lot of people here who are willing to share their time, experience, and expertise with us. And the reason that we get together each year is so we can share the newest information about exposures in pregnancy and breastfeeding in order to have the best information to pass along to all of you. So without any further delay, I would like to introduce our guests. Today's topic is going to be adoption. And so in-house, we have three women who are not only experts at MotherToBaby, but also have some experience with adoption and adoption information. And our focus is adoption in honor of National Adoption Month. And because we know that people have questions every day of the year, we wanted to be able to focus on those specifically aimed at adoption. Our first guest is Mara Gaudette, who works for MotherToBaby California and is a mom of three. We also have Lori Wolfe from MotherToBaby North TX, also a mom of three, and Kirstie Perrotta, also from MotherToBaby California, who is a mom of one. Ladies, thank you so much for joining us today. So I'm going to start with Mara. Thank you so much for being here, and would you mind telling us a little bit about yourself?
Thank you for having me. As Chris said, I'm a mom of three. Our family's formed through adoption, and I work for MotherToBaby California, and I focus a lot on our chatting.
So Mara, could you tell us a little bit more about your personal experience with adoption?
The first thing that I think that comes to mind is needing to fill out the questionnaire for what risk factors I would accept while looking at a potential placement. And I think it's fair to say you struggle with that for multiple reasons. One way I looked at it, if I'm too strict, would I be missing out on the perfect placement? Or if I was too light, would I get in a situation I wasn't prepared for? I think I got to a point where I was able to say there isn't necessarily an exact answer. And speaking to you, if there is a partner involved, speaking with my husband, make sure we're on the same place. The different life experiences make you comfortable with different things.
Thank you, Mara. And on that note, I think our second guest also may have had similar questions with the adoption process based on her own experience. So Lori, if you would like to give us some information about you, we would be very happy to hear it.
Yes, and thank you for having me on also. Our experience was a little bit different because we have a birth daughter, and after that we weren't able to have any more kiddos, so we looked to adoption. And already being in this field, I knew a lot about it, but yes, sometimes knowing a lot means you know too much. So then when you're filling out the forms, you're worried. And when you already have one kiddo at home, you're worried that, oh, you know, I need to try to match and have a good combination. So I know that we were concerned about how much of which exposures and what would actually be something that we could handle. So that if there's a known increased risk for a learning problem, for instance, is that something that we're good to deal with?
Understood. And Kirstie, what is your experience with adoption?
So I work at MotherToBaby California, and I have a son who's 15 months old. I don't have personal experience with adoption, but we do get these calls on a daily basis, and I really enjoy talking to prospective adoptive moms and dads and really answering their questions. And I recently had the opportunity to write a baby blog on this topic that's really helpful for people that are considering these types of situations.
So you were able to look into it from a slightly different perspective, as you said, not firsthand, but still gathering information to be able to relay it to the people that you come in contact with.
Yes, definitely.
Excellent. And what are some of the concerns that prospective parents may have?
So like you said earlier, exposures can really be a range of different things. We have people asking about prescription medications that are taken both as directed and abused. We get questions about alcohol, drugs, cigarettes, mental health medications, all sorts of stuff.
Is there one in particular that keeps coming up or that you've seen trending?
I mean, definitely alcohol is a big red flag for us. So I think that's one of the most important things to ask about in an adoptive situation, is if there's been any sort of exposure to alcohol. And then of course, if we can get information about dose and duration of use, that really helps us with our counseling. But I know that can be really tricky to get when you are working with an adoptive agency. So for example, I just got a question the other day from a prospective adoptive mom who was dealing with a birth mom that had a couple different exposures. She knew that she had drank alcohol and she knew that she was a cigarette smoker. And that information is really helpful to start with, but you know, if we really can get a little bit more specific, how often was she drinking? Was it binge drinking? Was she drinking throughout the entire pregnancy? Did she stop drinking when she learned she was pregnant? With the cigarettes, you know, how often is she smoking? How much is she smoking? Anything like that can really help us with our counseling.
And Kirstie, what is binge drinking?
So binge drinking is drinking anywhere from 4 to 5 drinks on a single occasion.
Does that mean a certain amount of wine versus beer versus shots?
Well, what we always tell patients is that alcohol is alcohol. So whether you're drinking 4 ounces of wine or a 12-ounce beer or a 1.5 ounce shot, it's really the same thing. And we do sometimes get the mom saying, oh my gosh, I only had 1 drink. And then we say, well, what size was that? And she'll say, oh, it was a 22-ounce beer. So we do have to always check to see what they're calling 1 drink.
I think that's a really good point. I think that's why Kirstie brought up dose. So how much are you actually using? And have any of you ladies had that experience in your adoption process with questions about alcohol or those other exposures?
We personally did not have the alcohol as much of a concern as we did with the drugs and medications. So we had more, in the cases that we were presented with, we had more issues with prescription medications, illegal drugs, and so on. And although it's always concerning, it was helpful to me to understand timing in the pregnancy so that when in the pregnancy they took it and how much they took determined whether or not there was a known increased chance for problems.
One thing I wanted to point out, you do have to consider, I always had kind of in the back of my mind, underreporting, and not because an expectant parent is trying to be deceitful with you, but you think for yourself, think 6 months ago, 9 months ago, what'd you have for lunch? What medications did you take? It's just hard to remember. So I think we do have to accept there's going to be some underreporting. There's also going to be alcohol use in pregnancies that will not go on to adoption situations.
Mara, I think that's a great point about underreporting. And as someone who does field these calls and has no firsthand experience with adoption, I can say that I do expect some level of underreporting, not only because, you may not remember, but because of the stigma attached to, admitting that. And I can only imagine that adoption in general for all parties is a very emotional, challenging situation. On top of that, if women do not want to add to the stress and the guilt that they feel, they may decide not to report. Again, not out of being mean or, not wanting the best outcome, but just the idea of trying to minimize their own discomfort, which is understandable. So Lori, you said something interesting before that I would like to go back to, if I may, in terms of prescription medications. What is it that prospective parents should be asking or should be aware of in terms of mom's prescriptions, whether she uses them as prescribed or not?
I think some of the biggest prescription medications of concern would be your anticonvulsants for seizure disorders, some of your heavy-duty painkillers like your codeine, hydrocodone. We honestly don't know if they're taking them as prescribed or not as prescribed, but it's always a good idea to ask, and to ask them, how often did you take this? Did you take it throughout the entire pregnancy? Was this prescribed for you or not prescribed for you? Because often the benefits to the mom for taking it is bigger than any potential risks for the kiddos, but we still need to look at that and discuss it.
And thinking about the reasoning that they're taking the medication can also be really important. For example, if someone is on an antidepressant and depression is something that runs in the family, that of course is a little outside our area of expertise, but it might be worth talking with a genetic counselor about those type of risks.
And as a genetic counselor, I would have to agree with you because I do know that we wonder, and we do have some data, but we don't have all the data in the world. And so, if something does come up in a child later on, of course, we know that you can't necessarily link it back to the medication, but a family history may sometimes be a stronger predictor of things that we can see. So I think that's a great point, that having all of those pieces of information may end up being helpful. Mara, in terms of questions that you think prospective parents should be asking, are there a few that come to the top of your mind?
I wanted to piggyback a little bit on the prescription medicine, because I know going through the process, a lot of my friends going through the process at the time were very concerned about the medication and not taking in mind, well, if the woman goes off the medication, if the expected mom is off the medication, she's going to be more likely to relapse symptoms for depression. There may be higher pregnancy complications in that case, or more likely to use self-medicate with other substances. So not to, I guess, for myself personally, I wasn't ruling out a situation based on the medication alone and wanting to take in a fuller picture. I would say speaking to the agency would be an important thing if you're filling out forms and you might be okay to certain risk factors. What happens when the match occurs and every single box is checked? Are you able to then reevaluate, or so you can be more open in the beginning because it's just giving them a guide, or are you more locked into the situation? So just finding out how your agency works.
Okay. And Lori, would you like to add something to that?
Yes, I know when I always talk to the adoptive families, and I know in my own case too, we're always asked about what range will we consider. So would you consider somebody who might be using something just now and then versus would you be considered somebody, for instance, who might be taking codeine her entire pregnancy? So as Mara mentioned, it is really important to look at what the parameters are and whether or not you are going to have some choice. And once you're locked into a placement, what happens when new data comes out? So we get new medical forms, we get new medical records, and oh my gosh, this wasn't told to us at the beginning. So are you going to have some choice, or are you already locked into that case?
Interesting. And I can tell you on the phone, sometimes I'll have people who have very limited information about the prospective child for adoption, and often, in my case at least with the parents I speak to, they have a very limited window of time. Very often I hear, I have 24 hours to decide. And they have so little information that it's very hard to give, as a detailed risk assessment as we usually do. But I will say one of the things that I ask if they know is, well, how far along is she into the pregnancy? Has everything been going okay so far? So have they looked at the baby through ultrasound? If she's past, around the 5-month mark, have they had the big ultrasound that can tell you if it's a boy or a girl, what they call a fetal anatomy scan? Have they taken a really good look at the fetus body through ultrasound? And if they did, and everything looked good, then the chance of birth defects is going to be on the lower side. So that can offer a bit of reassurance, but I also know, again, just from the counseling perspective, that sometimes I'm not able to appropriately offer that reassurance because we know so little. Kirstie, is that your experience as well?
Definitely. We try to ask about prenatal care because that can be an important factor as well. So someone that enters into prenatal care early on, they have a doctor or a midwife that's working with them through this process and helping with the risk reduction. So that can really have a positive effect. And like you said, having the information about the ultrasounds and how the pregnancy is going can really be helpful as well.
All of this has been really excellent information, and I want to thank you three ladies for being with us today. As we wrap up this episode, I would love to leave our listeners with a final word from each of you. Kirstie, can we start with you?
Sure. I think it's really important to remember that a lot of data shows us that even when children are exposed to medications, drugs, alcohol, generally children that are placed in adoptive situations and raised in loving, supportive homes, they always tend to do better. So that really is the silver lining.
Lori?
I think I'd actually like to mention 2 take-home messages from my own experience, since we're a little bit unique in the sense that we had 1 birth child and then we chose to adopt 2 more after that. There's 2 things to remember. One is, I get asked all the time, honestly, do you love them exactly the same? And you do. And the second thing is that there's no perfect exposure pregnancy, because it doesn't matter if it's our pregnancy personally or if it's another birth mommy's experience. There's going to be some type of exposure, whether it be cigarettes, or maybe you drank a little before you knew you were pregnant, or you took a prescription medication. So you sort of have to take that into consideration with the big picture, because there's never going to be a perfect pregnancy situation. And I've discovered over the years that if you're waiting for that perfect pregnancy situation, you're going to be waiting a long time. I've honestly had some clients who have been waiting 2 or 3 or 4 years, because every time they're presented with a baby, there's something, but you have to understand there's always going to be something, and most of the time they're going to turn out great and you're going to love them anyway. So in our situation, both of our boys did have a number of different exposures to both prescription and non-prescription medications. And even though, everybody has something, one of mine has dyslexia, one of mine has nystagmus, but of course we love them and they're doing amazing.
That's great to hear. Mara?
I guess my ending message would be that there may be so much fear now, but when it all wraps up, we have both closed and open adoptions, and we love our birth moms. So it's been a very positive experience. It's just in the unknown, when you haven't met someone, that's where the fear comes.
I think that's a really good point, that there is going to be that unknown. And Lori, as you said, whether you're the one holding the pregnancy or the pregnancy does originate with another woman, I think that there is always going to be that element of fear and unknown, and that's scary for all of us in all situations. So ladies, again, thank you so much for your time, your expertise, and your experience, really, because that's what we wanted to hear. We wanted to hear from other moms just like you who work in the field, who have that firsthand experience also, and we're very, very grateful.
Thank you.
Thank you.
And thank you to everyone who tuned in with us today. And if you do have questions about exposures during the adoption process, I encourage you to contact MotherToBaby. We do have experts standing by who would be happy to discuss the situation. And as you were able to hear today, not only do we have that professional experience, but we do have many people who also have that personal firsthand experience. So for more information, please contact MotherToBaby. You can visit us on our website. You can give us a call. You can chat, text, or email with us as well. And we're waiting to hear from you. All of our contact information is on MotherToBaby.org. And if you have any interest in being on our podcast, if you have a suggestion for topics or questions, please email us at contactus@mothertobaby.org. And as always, thank you so much for listening. We hope that you will tune in again to our future episodes. And remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit MotherToBaby.org.